We are going to have some riveting talks tonight about injury and survival of injury and sequelae of injury. And I feel like these topics are particularly pertinent because of the injuries that go on with everybody on a daily basis, but also because sports-related injuries and injury to head trauma has become a part of our sports
culture.
Thank you.
Expectation. So it's my pleasure to introduce Beth Ebel. Actually, this is a very timely topic because I have a 16-year-old who just started to drive, and I had to take her on the freeway the other day, and it was really PTSD for me as much as anything else, and for her also. So it's my pleasure to introduce our speaker. She's an associate professor in pediatrics at School of Medicine, director of the Harborview Injury and Prevention Research Center, and an adjunct associate professor in the School of Public Health and Epidemiology. She loves spending time with her family, and this is a gorgeous view and a gorgeous picture of her family. And her research interests are in injury prevention and health behaviors and disparities in injury and global health injury prevention in prevention and control. And in particular, sort of identifying interventions that we can improve in our child passenger safety in our Latino and Native American communities. And interventions, I'm going to listen very carefully, interventions to reduce teen distracted driving. I'm going to listen very carefully to this. So she received her master's in development economics at Oxford in London, medical degree at Harvard Medical School, and MIT. She also has an M.P.H. from the University of Washington School of Public Health, for which we are renowned.
Well, thanks so much. I'm delighted to come talk with you tonight. And you saw from my family, when my kids were little, I was all of a sudden interested in booster seat research. And now that my kids are getting bigger, I'm also getting very interested in distracted driving, and much to my kids' chagrin. So I have a chance to talk to you today about injury, and I'll talk to a little bit more about injury prevention, but we'll be also talking about a little bit about injury treatment, and then Doug Zatzik, who's a esteemed colleague, will be sharing a little bit with you about the sort of post-injury follow-up and really what's the science on how we can do better for people for their outcomes. And I just wanted to share a little bit about why I even got into injury research in the first place. I worked for a while as an economist and really for UNICEF abroad, and I was in Ecuador. And when I finally got a sense like, gosh, I feel like maybe public health, maybe I could be a physician and do some public health or something. So I went back to medical school, and then when I was doing my residency, I was in Baltimore at Johns Hopkins, and it was really an eye-opening experience. And I remember one of my early rotations in the emergency department, and I had a girl who came in, and she had been stabbed. And she was like a middle schooler. I mean, she was young. And I mean, I've been in war zones, and I just had never seen anything like that. And so I'm just trying to stitch her up, and I'm trying to think about the only public health thing I can even think of, and I asked if she'd had a tetanus shot, and she said, yeah, but when she had been stabbed by her uncle like 3 months before. And, it's just, you have these moments sometimes where it's a bit of a crisis of faith, because really, she does need treatment, right? She needs her legs stitched up. But that is not the problem. The problem is that 14-year-old kids should not be getting stabbed twice. That's the problem. So it really got you thinking, here I'm delivering health care for an individual, and yet health is, this is a community problem. I had another experience, and this was that my preceptor, Janet Serwin, we talked about, she encouraged us to get out into the community and go find out what's going on with our patients. So I had this little preschool or kindergartner who had attention deficit disorder, and I went to go meet with his teachers at his school, which it turned out was just a few blocks away from Hopkins, giant metropolis. And when I went out there, I met with his teachers, and I said, so how's Devin doing in school, and how does he do in recess? And they said, oh, well, we don't have recess. I said, really? I'd never heard of elementary school without recess. In fact, it was the largest elementary school on the East Coast. 1,500 elementary school kids. They said, no, there's no recess. I said, but there's a park area or field right adjacent to the school. And they said, well, that is totally unsafe. It's filled with, it's used by drug dealers. It's totally unsafe. And, so then I kind of come back and I'm like, again, I'm treating ADHD. I'm treating kids who were hit by cars all day long. And there's no safe place to play. So eventually I heard Barbara Barlow, who's from Harlem, came and talked. And she has done this incredible work there where she was creating safe places for kids to play, playground building. And she's a trauma surgeon. But she really had this insight and the wherewithal to do something about it earlier on. That was transformational for me, to really start saying that, as I'm delivering health care, and a lot of what I do is motivated by the patients I see, also, this bigger issue of health and how we keep people well is important. So I think that's really brought me into this marriage between the clinical care I deliver and the prevention work. So I want to talk to you today a little bit about injury, violence, and disaster. I want to tell you that one word you're not going to hear me say. You're not going to hear me say accident. Why do you think? Why don't I like accident?
No responsibility.
Yeah, it just sort of sounds like something that just God did to us without us having any role. It's basically like saying, oh, I died of fever. I mean, it doesn't tell me anything, and it doesn't help me think, what are the components that have led to the injury? So let's talk about injury, how big the problem is. I'm going to talk about one of the frameworks that we use to understand injury, and then I'm going to spend a few minutes talking about how to change behaviors, because this is a lesson that's hard for me, and I have to keep learning it over and over again. And then I'm just going to give you two examples of approaches of big problems, gun violence and distracted driving, where you can see some of these principles applied. But it's really these bigger principles. They do apply to sports injury, to concussion, to domestic violence, a lot of other areas. So I hope you can see this. This is a table produced by the Centers for Disease Control. You can pull this up yourself any day. If you're interested in data on injury, deaths, injury fatalities, anything like this, and you Google whiskers, W-I-S-Q-A-R-S, you can basically get the data yourself as a human and find out for your area what's going on. But what I want to point out here is that injury is very common. These are the 10 leading causes of unintentional injury deaths. And what you'll see is there's quite a variety, right? So little kids here, you have little kids who are dying. This is unintentional suffocation, but this is SIDS, which you probably think of as SIDS, which is really thought to be an injury problem. Then we have drowning. And in fact, in our area, this is one of the leading causes of child death. Drowning. Some of it's at homes, and much of it's open water drowning. Then you see this light blue group coming, and this unintentional motor vehicle traffic comes in, and what you'll see there, some of that is pedestrian injury, and then there's a big spike up when you get kids who are starting to drive, which is this 15 to 24-year-old group. Then you see this green bar. Well, interestingly, in our area, if you don't know this, the leading cause of injury death in our area now is not motor vehicle crashes anymore, is poisoning. And we are one of the higher areas in the country for poisoning deaths. Much of it has been driven by prescription drug poisoning. So this has been a big change in the epidemiology, and it reflects both the progress we've made with motor vehicle injury as well as this really bad problem of poisoning. So injury, sometimes you may think, well, this is a problem in wealthy countries like ours. Developing countries, we've really more of an infectious disease. And I will tell you that is not so. We have a project in Ghana, and what you see there is a combination between the diseases of poor countries and the diseases of rich countries right on top. So this is a table from the Global Burden of Disease Study, and they are comparing the major causes of, when I say GBD, this is basically how many years of productive life are lost due to this cause. And you will see here that the items that are here in, I have to look at your screen, green, these are all injury causes. So you can see that in 1990, road injury is number 12. And if you go over here to 2010, road injury has moved up to be the 10th leading cause of years of life lost in the whole world, And that's continuing to increase. You see increases in what's called self-harm, suicide. In the whole world, it's increasing. So injury is in fact a growing problem in terms of its absolute mortality, not just in this country, but through the entire world. You see falls, drowning, a huge problem for many people there. So injury is important. We don't think about it enough. There's not very much money spent on addressing this problem, which is frustrating. How else what do we know about preventing injury? Well, we often talk about the 3 E's, the first one being education. And I think that's where we tend to start thinking, I want to teach kids how to cross the road safely. That can be hard, and a lot of what we do through education may not be effective or may take some time. Another thing that's one of my best friends is enforcement, right? I want people to wear their seatbelts. I tell them about it. I talk to them about it. There's nothing like getting a ticket to drive seatbelt use. So law enforcement, having a law, is very powerful. And it's powerful not only because they catch somebody, but also because, interestingly, it sets a norm. It sets a norm for how we should be. And I'll give you an example from car seat. I mean, how many tickets do you think there really are for booster seats? They're not very many. But it's a law, and people know that, and really that gives parents, just strengthens the hand of a parent to say, look, you have to be in the booster seat, it's the law. So that it really, I think in that instance, is contributing more through a normative impact than it is through some sort of punitive impact through a police officer. And then we have modifications to the environment, and here I included physical environment and social environment. So consider something like drunk driving, okay? We have made tremendous progress in drunk driving, and we have worked on education. We've worked hard on enforcement. But we have laws. We've had to change laws and change the social environment under which drinking takes place. People still drink. People still binge drink. There are alcoholics. But it is no longer considered okay to let your friend hop in the car and drive home drunk. It's not. I'm not saying it doesn't happen some, but it happens less and it's not okay. So those social norms have changed. We'll often look at changing the physical environment too. And some of the biggest increases that we've seen in terms of injury prevention, let's say with our roads, have been these kinds of things. Vehicle design factors. The motor comes under your car. The seatbelt locks down. There's a crumple zone. There's impact protection. The airbags deploy. These are all environmental changes that are designed to keep you safe. You need to have your seatbelt on so that you're where you're supposed to be so the car can do its work around you. And likewise, road design. Another major concept of injury prevention was really developed by a wonderful guy named William Haddon. And you might guess that I actually stuck his head onto this photo. William Haddon was the first administrator of what is now the National Highway Traffic Safety Administration. And he really brought science to injury control. And he said, look, again, this is not just a monolithic problem. This is a problem that has temporal components, and is a transfer of energy. And if we can kind of break this problem down into boxes or pieces, we will be able to design more effective strategies. So this is Haddon's matrix. And Haddon's matrix has, as I said, across the top, you can see host, which is sort of, who got injured, the agent or vehicle, how that energy was transferred to the person, and what about the physical and social environment contributed to injury or ameliorated injury. And you see going down the rows, there are pre-event factors, event factors, and post-event factors. So here, look at this picture. What do you see? Okay, so somebody tell me something that might prevent what you think might happen here. What's going on? He's on his phone, yep. So let's take talking on the cell phone. Where would you put that in this box? Yeah, pre-injury, right? Unless there's an airbag in the phone, maybe prevent pre-injury. And he has a walker, so that's a pre-injury walker factor. He's distracted. Another thing, the crosswalk, right? So what's that? Where would that go? Which column? Yeah, physical environment. And do you think it's protective or not? You're right. Crosswalks are not protective. They sucker you in for the most part. What is protective is putting a crossing area where the vehicle traffic is forced to stop. But crosswalks, like a mid-block, they sucker you in as a walker, and they're routinely disregarded by vehicles, and you are at greater risk. We've learned from doing studies. So yeah, so you're getting a sense. The driver, looks like the driver wasn't paying much attention either, right? Because the driver is half in the crosswalk. So a lot of different factors here. The vehicle is really coming in, and you know, that vehicle, the driver might have been distracted there too. So you can see a lot of things. There are also post-injury factors. How old you are, you know, that matters in terms of how survivable this is, how low your head is. Little kids tend to get head injuries from pedestrian. Older people tend to get lower extremity or pelvic fractures. Your 911 system, how we care for you. Rehabilitation when you get home. Traumatic stress treatment. So now I want to spend just a minute talking about changing health behaviors. And I said this is a lesson that is hard for me to learn. We tend to study on the facts, the epidemiology of what causes problems. And sometimes I feel like that can really lead those of us who are public health people astray. And that is because we start thinking that if we could only give you the data, if I could only explain to you, and I'll tell you how bad it is to smoke, that you for sure will change your mind. And maybe you all will, right? Look at you. You're all here. You're here on the President's Speech Day. You guys are interested in information. So there may be some people who, with information, will change their behavior. But I'm going to tell you, it isn't very many people. And so the sad truth is that we do care about these things because of their public health burden, but we ought to keep very firmly in mind that telling people that this is a problem typically does not change their behavior. And we need to also bring science to that problem. So take smoking. We have to separate out why don't we want to smoke? Oh, smoking kills you, right? You get cancer, you die. You get heart disease, you die. It's bad for everything. But the sad truth is that we have had to learn for a long time that telling people that smoking kills you does not stop young people from smoking. To the contrary, why did they start smoking? Did they start smoking to please their parents? No. They started smoking to rebel against what their parents are telling them and to be cool, right? So really, if you're just going to preach at them, it's going to almost have an it's not going to matter. You can certainly in your behavior convey your behavior. You can have open discussions with your children. But ad campaigns that just show dead people or really sick people, that is not relevant to the immortal teen. So we've had to develop smarter things, and I'll give you an example from the Truth Campaign. Now this is a tobacco company ad, okay? And what do you see? Does she look like a good girl? No. She looks like she's out, this is who a lot of teens might aspire to be, right? She looks kind of naughty. She looks like she's having a really good time. She looks like she can do whatever the heck she wants. And it says down there what you're looking for. So this is what tobacco companies are going after. Sex appeal, rebelliousness. She's thin. That's another big piece. And she's dark. She's very goth. They're going after the whole thing. And so here's what the Truth Campaign has come up with. And this is so interesting because when you ask kids, you said, okay, what do you value? They said, you know what I value? Grown-ups not telling me what to do. And that's a problem for public health because that's just what we plan to do, is to tell you what to do. So here they've turned this message on its head. And they said, you know who really is the bad guy? Those fat, old tobacco executives. They are manipulating you. They are the ones telling you what to do. And they are exploiting you. They think you are stupid. They think they will wrap their product in a sexy bikini, and that is going to make you, a smart kid, be addicted to their product. So you see, this is the kind of message that you need to think about when you want to change that behavior. And you notice I haven't said anything about dying. Here, another one. Ammonia is great for cleaning toilets and increasing the impact of nicotine in cigarettes, okay? You're basically saying that if you smoke, it's just like gargling in toilet cleaner. And they're going right after that sort of, you're not sexy, you're not cool piece. This is the effective, so this is the hard-hitting message that we have to go after sometimes when we're dealing with behaviors where we know that telling you what to do is just not enough. Okay, so I'm going to give you a couple examples. And the first one, I just want to talk about gun violence. And this is an opportunity, I think, for us to step back. I grew up in Columbine. Columbine is my neighborhood. My mother is a teacher in the Littleton and Columbine school districts, and half of my neighborhood went to Columbine. There is nobody in this room who has not been touched by this. And while we hear about these big stories, Doug and I work at Harborview, we can just tell you that we see the consequence of gun violence every darn day. Every day. I was on 2 weeks ago, I had 3 kids in-house who were victims of gun violence. 3. So this is not a rare problem. And while, and this is a constant thing that we have in our place here. So it's something to give a lot of thought to. What do we know? Well, gun violence is, and I would say not epidemic, but endemic in our country. There are an estimated 31,000 people killed by gun violence each year. And I guess that's absolutely the bad news. And it is partly the bad news to say that in our country, gun violence is 20 times higher than other countries at our income level. So that's just the fact. And I think the good news must be that when you look at that, it's clear that there is a lot of preventable gun violence. I'm not saying that it's all preventable, and countries are different, but there is a lot of room to do better than how we are doing right now. In Australia and the United Kingdom, their rates are 30 times lower relative to the United States. And in King County alone, 125 people die from gun violence each year. More people in King County die from gun violence than from motor vehicle crashes again. This is not, however, only an urban problem. This is not only a problem of poor people. And we see injuries, and I think for me, again, these are, you get the chance, you get to see what a whole family experiences around violence. So I'm going to give you 3 cases, and then just talk about some of the things we've learned in public health that can be applied. I'm talking to you, we had actually planned this talk quite a long time ago, prior to the events of Newtown. But I might just mention to you all that this is not just an academic talk. You all have come out to be here because you care and you want to learn something and apply it to your life. This is going on right now. You as a citizen have a chance right now, whatever you think, whatever your views, to actually step up and be counted. There are 4 bills tomorrow that are being debated by our legislator. And this is a debate that has not been driven by people much up to now. So I'm mentioning this to you because I think there's lots we can do to get from that 20 times down to something lower. And whatever your persuasion or your beliefs, I know that you are not in favor of gun violence, because nobody is. And I know there are lots of things we can do better. So I just exhort you all to speak with your voices, whatever they may be, and this is the time. I'm going to give you some stories, and I'm not going to describe a specific patient story, but kind of a combination of many of the kids I've seen, just to kind of protect the stories of people so that folks aren't sort of going back through the newspaper to figure it out. But this is a 4-year-old girl who had a penetrating hemothorax, a bullet shot right through her lungs, her lung filled with blood. She ended up with a penetrating liver injury. She survived her gunshot. And basically, an older kid in the house had found Dad's, he just bought a shotgun, and he had stored it with the ammunition in it, and he was looking at it with a buddy, showing him this gun. And the gun, which was loaded and available to him, discharged. And that bullet went through the wall, through the dresser, and into the child who was watching TV in the next room. They were shocked and horrified. Again, this was a family member with another family member injured, which is a very common scenario when you're looking at pediatric gunshot injury. And so we were able to take care of this girl. We fixed her hemothorax, we fixed her liver, and she was able to go home. But this, again, this is not just bad luck. This is an injury with antecedents and elements that can all be addressed. And what do we know about unintentional shootings? Well, I brought up this first, but this is the smallest part of what we see. But these hurt. We've had a year filled with police officers who are forced to carry guns. I mean, they need to carry guns for their job, where their children killed. We've had shootings at school, unintentional shootings. And, it has just been a painful year. And you sit there and you think about how it is to be the parent of the child who is injured. You think how it is to be the parent of the child who shot the other kid. You think how it is to be the parent of both, a funeral and the perpetrator. And you think, boy, this is a situation where we can simply do better. Well, what can we do? Most people who don't own guns, most people who do own guns, believe that guns should be safely stored. And they can be. So there have been study after study showing that child access prevention laws, one that's being debated tomorrow, for instance, reduce the risk of unintentional injury in kids by 23%. That's not saying that when you pass a law that requires people to store their guns safely when there's kids in the home, it's not saying that it fixes all the problems or it's the magic treatment for everything, but it works and it reduces unintentional injury violence. So that's an example. Another study that was done at Harborview looked at components of the law: storing the gun in a locked place, storing it without the ammunition in it, storing the ammunition separately from the gun, and storing the ammunition locked. And each of these independently contributed to the reduced risk of suicide or injury in that home. We've done additional studies Dr. Grossman did up in Alaska, where he actually brought gun lockers up to Alaska, to some of the native communities, with some of the highest suicide rates in the world. And folks were delighted to have these up there. The average family had something like 10 long guns, if I recall. I mean, they use them. They're polar bears. They're hunting. They're using their guns. They didn't have their guns were, however, just stacked in the breezeway outside the home. And with that combination of depression and alcohol, people were getting killed, and the community felt the weight of this. And they wanted a place to put those guns out of the way so that the kids and the adults would be more safe. So there's a number of interventions that can really help with this child access prevention laws. So what else do we know? Well, it's not that hard to get a gun. This is a study that was done here in Washington State in 2010. I find this to be sobering. This was a study done among school kids, and you can see the first question: is it easy or very easy to get a handgun? 11% of 8th graders said yes. 18% of seniors in high school said yes. I would not be caught by a parent if I carried a handgun without permission. Okay? Have you ever carried a handgun? 8% of 8th graders say yes. 9% of 10th graders and 10% of 12th graders. I know one of my best friends has carried a gun. And so this is what I would say. Who among you did not find out where your parents hid the presents during the holiday? Was there anybody? No. I know where they, and why? Because kids are smart, and they are scientists, and they are inquisitive, and they will find out where the goodies are in the house. And that includes Dad's shotgun on the top shelf of the closet, where he seems to think that nobody would ever think about looking. That includes things under the bed. That includes things in the drawers beside the bed, where all the interesting things might be. Kids find them. You found them, your kids found them, and all kids find them. The studies show that when kids find that gun, they will pick it up. They will almost all pick it up. They will look at it, and a significant proportion will attempt to fire it, just to see what happens, not trying to hit anything. So that's why storage matters, and guns are around, and our kids can do it. Here's another case. This is a 17-year-old teen. This kid had a gunshot wound to the abdomen, went through the liver, the intestines, and the spine. He said he was basically at a gas station, and somebody walked up and was chasing him, and he said they shot him, and then his friend tried to chase after him, and then that was the end of the story. So it's a little bit of a funny story. I think if somebody shot you, you're probably not chasing after him unless you know him. So there's probably more to this story than that. And we see, we see a lot of violence in King County and outside of King County. Most homicides in our country involve the use of firearms, and handguns are a big part of it. They're involved with about 73% of the firearm murders that were used, and for non-negligent manslaughter. A study in King County had 71% of the homicides were done by guns, handguns. Nationally, it's more likely if you're shot that the person who shot you knows you. And in King County, those firearm deaths in King County were 12 times more likely to involve somebody that you know than strangers. So again, I think we think a lot. I mean, I'm not saying there isn't stranger-associated killings. There are, right? And they're worrisome, and they're fearful, and they shouldn't happen, and we need to look out and prevent those too. But it's just much more likely that you're being shot by somebody who knows you. Firearms in the home are associated with an increased risk of homicide, including occurring in the home, up to 2.7 times higher. So that's just the data. People can keep guns in their house. That's what the data shows in terms of your increased risk. So that's just a good thing to know from public health. You know, we do a lot of things that are risky in our lives. We make some choices, and this is a choice to make, but this is what the associated risk is. What do we know about gun assaults and homicides in King County? Well, between 2006, 2004, and 10, there were about 414 firearm injury hospitalizations. And our rate of assault was about 1.5 times higher here than it is in the rest of Washington state. But that's not 10 times higher. That's 1.5 times higher. And you see on this map that there's quite a lot of variation between some areas and other areas within King County. So what can we do for violence? Well, there's a whole bunch of things that can be done, and I'm not going to talk about all of these. Some of these are interventions that start earlier, with early intervention programs with moms that have been shown to reduce violence. We have important work to be done with bullying and mental health access. We also have important work done on things like background checks. Many people may not realize that in Washington, we have a very vibrant gun show group. You do not need to have any background checks to purchase a gun in that way. And in fact, I think it's something like 60% of the gun sales in Washington are going not through a licensed dealer, but they're being done through gun shows and private sales, where no background check is required at all. So if we have rules about background checks, they're not going to be applied. And this is the reason that Washington state is the leading supplier of crime guns to Canada, because it's very easy to get one here. And they are, along with the border states, one of the leading crime gun suppliers to Mexico. So the ATF will tell you that they have firearms that are sold in Yakima and used in a crime in Mexico 4 days later. They've had that happen. So it's very easy to get guns here, and that causes a problem, of course, for other places, but it causes a problem for us too. It also means that we really can't enforce some of the laws that we laid out for background checks, like people who have a history of violence, felony violence, or stalking. So here's another case. This is a 15-year-old gunshot wound to the head. Child was intubated and had a life-threatening head injury and subsequently died. This was a self-inflicted gunshot wound. What many people don't know is that suicide is more common than homicide. And these are some of the worst cases that I see at the hospital. There is a lot to be prevented in suicide. But one thing that is helpful to know is that in our area, and I don't know if it's our cloudy weather or what, we have very high rate of suicide and a high rate of suicide by firearms. This table shows you for King County, our suicide rate is 10.8. For Washington, our suicide rate overall is 13.2 per 100,000 individuals, compared to the US in general, which is 11.6. So we have a high rate of suicide. We have higher rates of depression. And we have, you see in Washington state also, a high rate of firearm suicide. So that difference, you can see there's that sort of almost that 1 point difference is probably almost half the difference of why our rate is higher than the national average here in Washington state. Of the 10 leading counties, we are one of the ones with the highest rate of suicide, of the 10 biggest counties. So what do we know about suicide? Well, here's an interesting fact, that 25% of suicides attempts, if you interview people who have tried to kill themselves but did not, and you ask them, when did you think first about killing yourself? And then how much time elapsed between that time and when you attempted to take your life? 25% of people will tell you 5 minutes. And when you see kids, I'm thinking to this kid I've told you, the mother came to me and she said she had an argument with her daughter, and her daughter said, "I hate you," and ran upstairs and slammed the door. And she was just beating herself up about this. Well, again, I don't know, I've got a teenager. I will question, how many people have not had a situation like that happen to you? And is this happening in a context where your boyfriend dumped you? Is this happening in a context where you're stressed for school, where you're being bullied, where you have other things that are stressful for you, and you make a rash decision And when that decision is done in a place where you have easy access to a lethal method of taking your life, then as I said, this can be a permanent solution to a temporary problem. And most of the kids who have attempted to kill themselves and then don't, they do not go on to kill themselves. So this is an opportunity, again, for us to address, many things. Mental health care, counseling with families. But part of this, too, is the easy access to a gun. And I really think if families knew this more and thought about this more, they would be more aggressive about having a gun in the home. And we don't talk a lot about depression in this country, don't talk a lot about suicide risk. But if you were to ask people, or people who are depressed, it's interesting how they haven't really considered sometimes this question of firearms in the home, because it's something that can be easily addressed and modified. So what do we know about gun violence? Well, we can do a bunch of different things. And this is, as I said, this is a time to give a lot of thought to it, because there actually are some opportunities to address it. We can ensure that the firearm purchases here are facilitated through a gun dealer and require a background check. It's something that could be done. We could look at who are the high-risk individuals who ought not just go and get a gun the next day. If you have one felony crime, a violent felony crime, you're over 7 times more likely to commit a felony crime when you get a gun. You can make the product safer. There are guns that can fire only when you're wearing a certain bracelet. There are guns that recognize their owner. And these might be a good choice for somebody who chooses to have a handgun in the house for protection or needs to have something for work. Guns can be kept away from children. And this can be done just through choice. This could be done through legislation. And the legislation is associated with the decreased risk of gun violence. And then, interestingly, in our place, the city and county is not allowed to pass more strict gun laws than the state. So there's a restriction. So King County public places cannot pass their own rules. So lots of different things that could be done. There are more than this. And from my perspective, from a public health perspective, I can sort of consider this going to a restaurant that there is a big Chinese menu of options. There are lots of things there. And we are so far from where we ought to be that I think there's lots and lots of room to choose something to make it better. So, on a totally different subject, I'm going to talk to you a little bit about distracted driving. And this is something I do research on. This picture I love because it's got a combination of sweetness and terror to me. So what do we know about, let's see. So I think I, for some reason, forget the title there, but let me give you a couple cases here. A 16-year-old patient crashed his car. He'd had an earlier fender bender, and he was wearing a seatbelt and sustained a stable pelvic fracture. His parents later looked at his phone and found out he'd sent 3 text messages right before the event. And they come to see you as the primary care pediatrician to ask you for your advice. And they are fuming. They are fuming. So what do we know? Well, there are now more phones than people in the United States. And 28% of vehicle crash risk is thought to be due to cell phone use or text messaging, to distraction. At least that cell phone use or text messaging is contributing to the risk of a crash. There may be other factors too. And I talked to you earlier about behavior change, but here I'm going to point out again. You all know, and everybody knows, that it's not good to talk on the phone in the car. And you all know, and everybody knows, that text messaging is a risk in the car. And guess what? They do it anyway. They have no intention to stop, and there's all kinds of reasons why. Well, what do we know about crash injury? This slide shows you that there is a huge peak in motor vehicle crash rates among young people. And I might add, it also points out that the phrase women drivers should only and ever be used as a compliment. But you can see this high peak for learners who need to integrate skills. They need to integrate skills, and that's hard to do, and you really need to give it your full attention. Teens are very risky. When you are in the car with a teen, he has your crash risk. And the instant he steps out of that, or you step out of that car, he has his crash risk. And that is on average 700% more than yours. Kids have different risk profiles. Some of them are clueless and they're risk unaware. Some of them are risk seekers, and you know some of those people. some of them are distracted. And they're really trying to figure out what they're going to do to drive. Now, we've seen progress, as I mentioned before, in the country as a whole, a reduction in motor vehicle deaths over time. This is fantastic. It is a public health accomplishment. But we are seeing also an increased risk of distraction. One of the best studies, this has been a little hard to study because, of course, people are not very honest about distraction, certainly not to the police officer. So in this study, they put cameras in the car of truck drivers, and they recorded everything that was going on in the truck. So the risk of, here's an example, if you have a 0.08 alcohol level, your risk of crash is about 4-fold above baseline. If you are talking on the phone, hands-free or hands-held, your risk is about 4 times that of baseline. Now, you can hang up the phone, and if you're drunk, you're drunk. And a lot of what we see is over 0.08. So this is no way, drunk driving is a huge problem. What do you think it is for text messaging? Give me a number. 7. Higher? 16 higher? It's 23 times. 23-fold. Truck drivers, skilled truck drivers, had a 23-fold increased risk of near-crash events when they were texting. And why? Their eyes are off the road. In a 5-second period, their eyes were off the road over 4 seconds, during which point their semi-truck went 100 yards without looking at the road at all. So that's the thing. Text messaging sucks you into its world. Now, in a recent phone survey that NHTSA did, they called people up and they said, hey, have you been in a crash in the near future, in the last little bit? And you can see, again, this group of young people, these 18 to 20-year-olds, and that's not even the 16-year-olds. I think they wanted to confine their study to adults, so they didn't ask kids. That group, 17% of them in the past year had been in a crash or a near crash. And then they went and said, okay, what were you doing, if you were in a crash, what were you doing right before the crash happened? And now this is on the phone, so the guys can be a bit more honest. And look at this young group, 18 to 20-year-olds. Basically, 2% were talking on the phone with a mobile device, 3% were reading a text or email, and another 8% right before the crash were sending a text or an email. For a total of 13% engaged with their device that minute right before the crash. And those are folks willing to say so. This is a big problem, and it's going to be even bigger. This is not just kids. Recent study, and this is not a good study design, so I'm just going to blow through it, and it's a convenient study. But this was a study of new mothers of kids who were under 2 years of age. And it was a web-based study, but just to say that in this study design, 78% of the moms talked on the phone while driving with their kids, 26% sent texts, 55% speed when they're late, and 10% had been in a crash with their baby in the car. So this is not just young people, this is a lot of people. We know for distracted walking, it's the same thing. We did a study on this, and we've really found that for crossing the road, texters, you might have thought they'd look carefully before they crossed, but they were 4 times less likely to look. They didn't look both ways. They walk slowly, and they're not looking at the cars when they're in the street. And this is probably you, some of the young people. I will try not to look at the young people over here who know who I'm talking to. On these tasks that require full concentration, they require you to put the phone down. I mean, if you hit a lamppost on the sidewalk, I don't really care. But if you're struck by a vehicle in the road, you're going to be seriously injured. So we know that texting really sucks you into a different world. Many of you may know about Pavlov. And what has struck me about cell phones is that cell phones are almost the classic Pavlovian model, as you know, right? Bell, response, and reward, right? Bell, response, and reward. That's how we did with dogs that were salivating. And that's how your phone is. The bell rings, oh, it's Joni, reward. The bell rings, oh, Freddie. And that's how it is. And you practice that from 11 to 16 or 17. So why would we be surprised that when the phone rings, you don't promptly pick it up? You've been classically conditioning yourself every day for 5 or 6 years. So this is a problem, and people, even though they say they're not going to answer the phone, they do. We've done some studies looking at compulsive cell phone use, and we found that for every 1 point increase on a scale of compulsive phone use, there is a 1 percentage point increase in the number of previous crashes that we report. And the strongest piece that associates with this is anticipation. So I'm not saying this is an addiction in the same way that alcohol is, but I'm saying this is a highly conditioned behavior. For some people, this probably is somewhat of an addictive behavior, but for all of us, we're really pretty blissfully happy doing what we know is already bad for us. And telling us it's bad is probably unlikely to change our behavior. So what can we do? Well, I am not personally optimistic about education. Scare tactics, blood and gore do not work for these kind of behaviors. And even though I think this is a catchy campaign here that one of the car companies puts out, I do not think this alone is going to do the trick. You might think about it, but then your phone's going to ring and you answered it and nothing happened. And then the next time it rings, you answer it again, or you send a text and nothing happens. And you fall right back in your ways. So I think we need something more. And part of that is enforcement. You know, we have a law now requiring that texting is illegal. You get a $124 fine. And we're doing some active research with the police officers to improve their enforcement. And this may involve things like going over overpasses and watching people, seeing what they do over overpasses, actually stopping drivers and maybe having photographic evidence, and really working with police officers so they know what to be enforcing, because really they have not been enforcing this aggressively. In 2010, the State Patrol, I think, had issued 34 texting violations total. I mean, it's been challenging for them. But we can clearly do better, and when there's been targeted enforcement, we have done better. So we can work to improve enforcement. What else do we know? Right now, you can't enforce the laws for young people because you don't know who they are. But some states, like New Jersey, are having a plaque that you can put on the vehicle which identifies learners. And this allows you to start enforcing differential laws like the graduated driving laws, and they're not supposed to have other teens in the car, or they are actually not allowed to use hands-free or handheld phones in the vehicle because of those concentration issues. So there's some opportunities to really do better enforcement. Lastly, what else might be fun? Well, you can talk to your kid about that, and that's important. Again, I'm not totally optimistic that just to talk with your parents is going to change the difference, but I think kids should be aware of your expectations of their behavior in the car. There are more things. I have a study going on right now. We're enrolling teens who are new drivers. We put a camera in the car that's triggered by an accelerometer. So if you have a sudden stop or swerve, the camera records the last few seconds of your behavior right before that time. And it looks into the vehicle and out of the vehicle, takes that footage, sends it to a company, they score it for an individual at your level of learning, and they send it with a video link back to you and your parents. So you can review it, and you can discuss it. And it sounds very Big Brother, but I'm also telling you, it's no joking matter. Kids are killed from this. And we all kind of joke, oh, I'm going to get my kid a beater car or something. Why? What are you saying? You're saying she's going to crash the car. And you're blissfully ignoring the fact that she hopefully isn't going to get injured. So kids, this is so high risk. This is something where if you can learn from near misses, it really accelerates the pace at which you can learn to be a competent driver. What else can we do? Well, another part of my study is disabling the device in the car. It turns out that cars have the ability to link your cell phone, your electronic thing, to the ignition on the car. And you can have a device that disables the text messaging, sends a nice message, oh, Beth is busy, she'll get back to you later. And that way, the kids don't have to keep making this decision that they're unable to make in the car. 911 is still allowed. You could still use the navigation system if you want, though it's probably distracting too. And you could override it. So this is another potentially promising strategy. Kids aren't going to be thrilled to sign up for it, but again, this may be important for them getting more access to the car. You can tailor the vehicle environment. Car manufacturers have developed a key so that this is the kid's key. And when you hand them the key, that programs the car to maybe limit the speed, limit the audio volume on the radio. It can disable mobile communication systems in the car. So you could tailor a vehicle environment. And that being said, it's going to take 20 years, until this sort of permeates down through the car stock to the cars that the kids get to drive. Lastly, you might have heard a story on NPR about this. Your vehicle has a black box in them. 95% of the new vehicles have this black box system, which you might know about. It's on most new cars, and there's still, as the NPR study pointed out, a lot of debate over who owns the data in this black box. But it knows a lot about you. When you crash, it stores the last bit of data, and it knows things like your maximum speed, how quickly you were decelerating right before hitting something, which will say if you were paying attention or not, how soon the brakes were applied before impact. and other things. So that's there. And insurance companies can take that information, and they may be using this now to risk stratify for your insurance premiums. And even if you don't like it, they might say, oh, would you like to sign up for this program? If you do, if you don't, you're in our regular insurance pool. But if you do, we'll give you a discount. And then we'll come back and look at your data a month later, and we will find out what kind of driver you are. So this is being discussed in many states. There are laws about privacy that are needing to be reevaluated because of this, this approach. There's always lovely wishful thinking that our cars are just going to drive us, and then we can sit there and surf Facebook all the way to work. And these vehicles are in production, in fact, but there are significant limitations. I thought, just for fun, we would find out for you all, if this is going to work, we'll see, if you all are, what your behaviors are. So let's try this. This theoretically should let us know. So I'll tell you how it works. This is only going to work if you have a phone, so some of you may be clear, and if you text. But if you do, and I see these ladies over here, they're pulling out their phones. So this is what you do. Go into your text messaging program, and you're going to send a message to your good friend, and your good friend's number is this, 37607. Okay? Audience at home, you could do this as well. So you're sending the message to this number, 37607. This is just like voting for American Idol. And then the message, the body of the message that you're sending is going to be here. You are going to text the number 474215 if you never talk on the phone while you're driving. If you rarely do, you text 474222. If you weekly talk on the phone while you're driving, text 474223. Daily 474248, or most trips, okay? Boy, so I'd first like to congratulate you all. You are the safest audience that I've ever been in. Let's look at texting. And let's say, how often do you read a text message while driving? Now you're going to send, you already got that number in your phone now. So now here, this is the message number that you're going to do. It's to 37607. So you're going to type in, if you never text, you type 474274 in the car. Oh, so, yes, if you read a text in the car. That's right. Okay, so you choose your category and send that text message, whatever it is. Okay, so here we go. So good news is 14 people who actually have a texting capacity, which is probably not everybody here, never send it in the car. Good for you. You're my favorite people. You never read them. Oh, hopefully you're not sending them and just not reading them. But you can see that there's a lot of people still, there's the rarely group, and there's still a lot of people who are doing this on most trips. It's common. So this is if you send a text message while driving. And hopefully you'll be better than the mothers of those 2-year-olds. So I'm just really saying that we as parents, you know, I know that kids are at higher risk, but I'm just saying we have a choice in how we demonstrate behaviors in our own cars. And we should take that choice because the people we're sending messages to are the people who love us most. Well, again, I just want to congratulate you. And you know, from a public health perspective, yay for you. Don't start doing this. If you're not doing it, don't do it. When I have people tell me, oh, I'd have to lock my phone, my purse in the trunk so I don't, you know, send text messages. I say to myself, good, you know yourself well enough to do this behavior, but it's just pointing out to me again that this is a very hard behavior to change. I'm not optimistic that just telling people little TV ads, AT&T's program, all nice, at the same time they're marketing every new car to you that you basically can surf the internet while you're driving to work. We have a real big problem on our hands, and this is going to take a very concerted effort with education, enforcement, and environmental changes to make a difference. Well, thank you.